write it down. We will answer everyone. We also have telephone lines, mail and email, and telephones open. So anyway, let us, we'll do our very, very best. I want to thank General Landrieu, who is here, for giving us this building. General Landrieu. And I think it's appropriate because when we send our troops to battle, to defend, to protect, to make this country better, which this Democratic Town Hall is, they launch from this room, okay? So let's be respectful of our troops. So we think this is an appropriate room. It's one of the biggest venues in the river parishes. Obviously, it's not quite big enough because there are people out in the hall, and I'm speaking as loudly as I can to try to accommodate by having a large room. But this discussion is going to go on in many rooms and forums around the country the next, couple of months. So I just want to begin with saying thank you very much. And I'm going to give 5 minutes of just opening remarks, and then we're going to open it up, okay, for questions, and we've got mics everywhere. We have, of course, a great country. And we have healthcare systems, as Paul said, that are different for everybody right now. We have about 20%, we have about 50% of our population, maybe 50% in here, I don't know, that have health insurance through their employer, through their government employer or their private employer. Then we have about 20% of people, I'm going to rank order the percentages, 20% of people that don't have any insurance and don't qualify for anything that exists right now. Then we have about 16% of people who have Medicaid. And you have to qualify for Medicaid. You have to have a very low income. Then we have about 13% of people, many of you may be in this category, I don't know, that have Medicare. You have to be 65 and older, and it doesn't matter what your income is. And you have your Medicare system. And then there's about 1%, 4% of the population that is self-insured or privately insured. So they have their own insurance, not through an employer, whether it's public or private, but they have their own insurance. And then 1% of the population is on the veterans system through Veterans Health Care, Veterans Hospital, or TRICARE. So just so that you all understand who you are, that's kind of generally it. So when people say, this is my health care system that you're familiar with, you may be familiar with the one that you have, but you might not be familiar with what everybody else has. And so that's why it's important for these town hall meetings. So we're going to ask, and Paul has some questions